We're going to discuss today just a little bit about the equipment and the initial avian examination, antibiotics, leg fractures, Elizabethan collars, and pro-banging eggs. These are some of the things that were an interest was shown. And the first thing I'd like to do is talk about some of the equipment that will help. And with that, and by the way, like everybody know, please, if there's any questions, put it on the chat. I haven't had an opportunity to experiment with how to get there. It may be at the end of the meeting, but if I can get there beforehand, that'll be fine. But some of the equipment we'll use are, you'll know, scales, and I'll go over this later, some different scales. We have just fingernail clippers, mouth speculums, and sometimes I'll use the bird mouth speculum, sometimes just like this little plastic kitchen tool. I'll use that to open their mouths. We use little files to file down beaks or nails. Up here in the top right corner, you can see a Dremel drill, and this is just a little tool from a hardware store that we will sometimes use on beaks if they need to be done. But like you can see, this equipment is very, very simple. So it's not an expense to acquire it. Here are different perches, and the scale on the bottom here is just a kitchen scale that I got it at a store, and it's a gram scale. And the one on the top is just a regular kitchen or a veterinary scale that I've taken the top off of. And then you can buy or make little perches. Sometimes I'll weigh them in boxes or in their cages and then subtract the weight of the cage. And then sometimes we use the perches like this if the bird will sit on them. And this is a little Nanday conure that was happy to sit on the perch. He's 119 grams, and that's about perfect for a Nanday. The other thing we use is, again, fingernail clippers and the bottom on toenail clippers. And again, you want something to stop bleeding if you get that, whether it be a powder or even flour, or I've even heard using ashes or something like that. Just whatever it takes to push against the nail to stop the bleeding. Mouth speculums for opening the mouth, and we'll see that later in use. And then different syringes, and we'll use these both for injections and for giving oral medication. On the left is a regular syringe. On the right are two insulin syringes that are very good for birds because of the small amount of antibiotic that we give. These are the things that I'm looking for when I'm examining a bird. First, we get the bird with a towel. And again, I like to use a towel and not a glove, just because that way the bird doesn't become afraid of the owner's hands and people grabbing them. And whether it be on the table with the towel over the top and then getting the bird, or on the floor, which is sometimes the easiest, since some of these will fly to the floor, and pick them up this way. Then once I have the bird in my hand, and I'm usually going to have my technician holding the bird, holding the head and the feet. And then I'm going to feel the keel bone. Now the keel bone is right in the center, and I'm going to feel the keel bone. We'll show this later. And I want to feel the muscle on the side of the bird, because this is how I'm telling whether the bird has been eating, or quite often, just like a doctor, when somebody goes into their doctor, they can tell if they're skinny or if they look like they're well fed. You can see that this is a bird that doesn't, obviously is feather picked and doesn't have any feathers. And the reason I picked this is just so you can see there's the keel bone in the center here. and I'm feeling that. You will always be able to feel the keel bone because the muscle attaches to the keel bone. It doesn't go over the keel bone. If I can't feel the keel bone very well, or it's down a little bit, it's because the bird is fat. But you can see this area, and it's just like a chicken or something. We've got good white meat, breast muscle here. If I have one that's thin, this is again a bird with no feathers over the chest, but you can see we call this a razor keel, or he's very thin. And when I feel this keel bone and I feel for this muscle in this area here, there just isn't any muscle. I can tell this bird here has not eaten for probably a week, and is not getting enough nutrition. And that can be due to the wrong diet, or it can be due to the an illness this way. I'm going to look at the head, and I'm looking at the nostrils, and we call them nares in birds, but we're looking at the nostrils, and I'm looking for a few things. I'm looking to see if there's any nasal debris or anything like this, if he's been sneezing, if it's wet. If I see an area like this, and it's a little hard to tell, but that's just a lot of what they call keratin material. It's a lot of old cells just stuck in that nostril. And quite often, this is because of vitamin A deficiencies. And it's usually just very crusty. The problem being that even if I pick this out of the nostril, it's probably going to reform. This is a situation where the diet needs to be improved on. Quite often, vitamin A, such as vegetables, can be given here. Other things I'm looking for is if sometimes there's a little grooving down here, it's where there's been a lot of nasal discharge that has continued and continued and continued, and we can have a little bit of a groove here. But the main thing I want to see is a nice, clear nostril. You can look in the eyes and just make sure they're visual. Birds get cataracts, just like dogs and cats and other animals get cataracts. One thing to remember on birds is for their iris, they have striated muscle instead of smooth muscle. And because of this, normally if I shine a light in a dog's eye, the pupil will get small. And if it's dark, the pupil will get large. With a bird, they can control their pupil size. So when you're shining a light in the eye, they can control what their pupil is. So don't be surprised if you have a large pupil, small pupil, if they're moving their iris while you're looking in the eye. Because like I said, this is a striated muscle. It's different than in dogs, cats, and humans. But I am looking to see if there's any cataracts, if there's any corneal irritations. What I'll find is sometimes birds will get kind of slapped in the eye by another bird's feathers, and they'll get a little bit of what I call a brush ulcer, or they'll get a very, very shallow ulcer, but they'll be squinting a little bit on and off. And usually these will stay clean. They don't really need a lot of antibiotics, but I do tell the owners that it will quite often take sometimes 1 to 2 months for this to get better, whereas in a dog, it would take 1 to 2 weeks. And it just takes longer in some of the birds. Not to be worried about it, but it does take a little bit longer. When I'm looking in the mouth, and here's this one of the speculums that you'll notice I put in there, and it keeps the mouth open while I'm looking. The main thing I'm looking for is right here in the center. You can see the choana, and that's a slit in the roof of the mouth. This communicates with the sinuses or the nostrils, and there's a lot of sinus space in birds. But we have the choana here in the center, and you'll notice Now, not all birds have sharp papilla. There's some species of birds that they're not as dominant, but you'll see these little sharp pinpoint projections here called papilla. And normally those should be sharp and well defined. If they start looking blunted or whitish, then I'm concerned about either drainage from the sinuses, like a respiratory infection where the fluid is coming down into the mouth, or sometimes I'm worried about vitamin deficiencies such as vitamin A. This is very common on birds that only eat seed diets, the big parrots, where they only eat seed diets, can get vitamin A deficiencies. Birds have a dry sinus. They don't have a wet nose like you and I do. So there really shouldn't be any fluid. It should be moist, but there should not be any drainage. And that's what I'm looking at here. I'm going to listen to the air sacs. Birds have lungs, but the lungs move the air, but the air does not stay inside the lungs like it does with us. If I breathe in, then I've got my air in my chest. And then I'll breathe out. On birds, the air goes past the lungs, but into one of 9 air sacs. And so what I'm listening for is an air saculitis or an infection in the air sacs. And again, it's easier to listen over the back than it is the chest. Sometimes the bird will sit here like this. Usually they are in a towel, and you have to listen kind of underneath the towel while somebody's holding the bird. This was a very wonderful little, this is an eclectus parrot. We know it's a girl because it's red. The male eclectus parrots are green, and they're about the only bird we can tell easily the boys from the girls. I'm going to look at the droppings very closely. Birds, we're going to have the stools. We're going to have the solid stool here, and it's going to be the feces that is coming out. Remember, everything empties into the cloaca at the end of the bird, whether it be the stool or the urine or the reproductive tract. But what I'm looking for here on a smaller bird is the stool, and then I'll have white urates. This is the part of the urine that is concentrated in the kidneys, and this is uric acid. It breaks down into uric acid rather than all the way down into urine like it does in mammals. Unfortunately, that's one of the reasons birds will often get gout, condition of uric acid in the joints or in the kidneys, or sometimes in the abdominal area around the heart. But they can get gout because of this uric acid deposit if they get dehydrated. And then you'll also get the urine, which is just a watery portion. So quite often the birds look like basically like a fried egg. So you have the green part, the white part, and the clear part. This is a parrot stool. That's all normal. I have white urates. I have green stool. Sometimes the green will be diluted with everything else, just because the fact that I'll have birds that will have the urates and the feces come into the cloaca, and then they will sit there, and just like putting dirt in water, it will kind of turn muddy, so that when it squirts out, sometimes it's a little watery. That does not mean it's diarrhea. It means it has just been sitting in the urates. And birds can quite often get polyuria, which is increased urination. And we don't want to confuse that with diarrhea, but it's increased urination because of eating a lot of fruit or vegetables or something where they're taking in a lot of water. If we eat a lot of fruit, we're going to urinate. If they eat a lot of fruit, they're going to urinate. But the main thing I want to do is notice that those urates are white. If we start getting yellow urates, like right here, in a lot of cases, that's going to show liver abnormalities in a bird. It doesn't tell me what's wrong with the liver, but that makes me really, really pay attention to urine or to liver issues rather than kidney issues, but liver issues. If we get this area here that is red, quite often that'll be suggestive of lead poisoning. And these are quite often birds that have been chewing on the side, on the paint on walls where they've used the old lead paint, or sometimes people that have repainted their cage with lead paint. Sometimes I've seen birds chew on stained glass windows and get the lead from stained glass windows. But quite often those are red urates. These yellow urates suggest liver. I want to see white urates. That's normal. If I start seeing seed, you'll notice here, this is a bird that has nice white urates, but there's seed in the stool here. That usually I worry about either, they call it Pro-Ventricular Dilatation disease. That is a virus that attributed to the Bornavirus, but it is a virus in birds that causes the seed to not digest, comes through. You're going to see seed in the stool. You're going to see a bird who is losing weight and quite often throwing up. It can also be because of ventriculous diseases in the gizzard of the bird, because remember, in birds, they have their mouth, then they have their crop where they store the seed. Then it goes down into the stomach, which is the proventriculus, then into the gizzard, which is the ventriculus, where they grind the food up. Then it goes in the intestinal tract, then into the cloaca, where it is all gathered together, and then out through the vent. But if I see seed in the stool, that's a very serious thing. If we get into the different antibiotics we use, we're going to use injectable or oral antibiotics. And the main thing that you want to watch for is where they would be getting the bacteria. Very, very, very often, it's going to be contaminated water. And the birds should be drinking the same thing that people drink. In fact, actually probably cleaner than the people drink. It would be nice if they had boiled water or filtered water. Gram-negative problems are very common in birds. And that's something that quite often people, believe it or not, will do better with the water than the birds will do. So we really want to watch the water. Also, contaminated food. There's been studies just in bags of bird seed or food where you can have bacteria in there. If people have left food out and it has spoiled and they feed it to the bird, we can have that situation. Also, dirty cages. Bacteria can come from trauma, just like bites and different things like this. And then also contact from other infected birds, just like you and I would get a bacterial infection from somebody else. Most of the bacterial infections are gram-negative organisms. So it's E. coli, Klebsiella, Pseudomonas, and those. They don't have as big of a problem with gram-positive. In fact, on the skin, where we have bacterial staph on our skin, you really don't see that much in birds with having skin issues. I mean, they'll have skin issues, but not bacterial skin issues quite often. And it is best if you can do a bacterial culture sensitivity, but most of us don't do that. We usually try to find an antibiotic that would be a good choice, and we will try to pick it that way. If I am going to do a bacterial culture and sensitivity, I am going to basically either swab the choana or the roof of the mouth up here. I'm going to put my speculum in there, open the mouth up like I did on that little conure, and then take a cotton swab and swab in that little slit for respiratory. Or if I'm thinking intestinal, I'm going to stick it up the vent in the rear end of the bird and swab it around. And sometimes you do both. you do the mouth first, then you go in the vent, and we call that a cloacal swab. And you can send that to a laboratory and find out exactly what bacteria, if any bacteria, you're dealing with. And like I say, one of the things we always want to do is we need to make sure that the owner can give the medication. It doesn't do any good to send something home if they're not going to be able to get it in the bird. And so we want to make the best choice for the bacteria and the best choice for the owner. For oral antibiotics, these are some of them that we will use in the United States, and I think are available in India. I got some information from a laboratory in India with culture sensitivities, and these are oral antibiotics that we will use on birds. You'll notice the enrofloxacin right here, we call the brand name here is Baytril, is very, very common. Ciprofloxacin is a human medication, but these two are almost exactly the same. The enrofloxacin, we will usually use the injectable enrofloxacin that you can squirt in the mouth or give orally. It tastes very, very bitter, so we usually have to sweeten it up a little bit with some fruit juice or something, but you can do that. The ciprofloxacin is a tablet for people that you can dissolve in water and squirt in the mouth. So these are very, very common. You'll also know the amoxicillin, clavulanic acid, ceftazidime is one of them, minocycline. But like I said, quite often we'll go with one of these two. Veterinarians are a little embarrassed that we always seem to go pick that as our favorite antibiotic, but it's like a friend of mine said, it really, really works. So sometimes it's a good choice. There's one called trimethoprim sulfa, or SMZ-TMP, and this medication here, it tastes very good for the birds. It's made for children. It's a pediatric suspension or children's suspension, and it can be given orally. I give that a lot to my young birds, the babies, if they seem to have a bacterial infection. And what you will see in babies a lot of times is they will get they call it sauerkraut. They'll start getting a lot of fluid up here in the crop that is not going through and not digesting. But sauerkraut is what I suggest people like a toilet. If we have water backing up in the toilet, it's not because it's in the toilet, it's down in the pipes further down. So if I have fluid accumulating up here in the neck of a bird in the crop, it is because I have some sort of problem, bacterial infection or something deeper down. And if I have that, giving an oral medication quite often isn't going to do any good. I have to give injectable, because if I give an oral medication, it's just going to sit there in the crop and not go anywhere. So those are things we think about. But trimethoprim sulfa is very good with babies. And doxycycline, we will give for quite often a chlamydia, or what we call psittacosis. That is parrot fever. It is something that we don't see a lot of anymore in the United States. However, it is very, very prevalent, and it was for the first 20 years of my practice. It can be given in the drinking water, quite often with cockatiels and other birds also, but cockatiels are famous for this. And in citizens, you can actually give it directly into their mouth. And you'll notice at the very bottom, if given for chlamydiosis, it's given for about 30 to 45 days. 30 days for the smaller birds, 45 days for the larger birds. Also, if you give an antibiotic to a hand-feeding baby, we're talking about from 3 weeks old to 10 weeks old or so, you really need to give something called nystatin, which is for yeast infections, because they will get a secondary yeast infection when you give the antibiotic. And we can talk about that further if we need to. Oral antibiotics, I like to use little regular 1 milliliter syringes or insulin syringes like we have here. And so we can get a proper dose. If I'm getting an injection, what I'm going to do is feel for that keel bone in the center, just move sideways and give the injection. The keel bone goes like this, so it is solid bone. You can't go into the heart or anything. If you can feel the keel bone, you're in a safe area. If I go above the keel bone, I'm into crop and I can't feel the keel. If I'm below the keel bone, I'm into the abdomen and I can't feel the keel bone. If I can feel the keel bone, I'm just going to move sideways and give my injection there. So you don't have to worry about going too deep, but you just want to give it in the muscle. This is an insulin syringe. And where I'm giving it, you can see right here on that previous slide, my injection site is just in the muscle. And different antibiotics you can use for those. Here are some of the antibiotics we use. Amikacin, I use quite a bit, which is the bottom one. There's one called gentamicin, which is an aminoglycoside, which we really don't use anymore. It's very, very dangerous to the kidneys. And if that's the only choice, then sometimes that's your only choice. However, you have to be very careful about giving that for longer than 5 days. So you just have to be very, very careful with gentamicin. But amikacin is nice because it can be given once or twice a day. You'll notice the other antibiotics have to be given a little more often. And but those are your injectables. The biggest problem that you get with birds is we have a lot of species of birds, everything from the tiny finches to, the macaws and the cockatoos that are very large. And we have found doses for them, but we seem to be using the same doses for a canary that we use for a cockatoo. And that would be saying we're using the same pound for pound doses on an elephant that we use in a dog. So we know that probably our doses aren't perfect, but we're hoping that research just gets better and better and better over time. Practice tips. On the interfloxin, if you have an antibiotic that tastes bad, you want to sweeten it. And you can add fruit juice or a little honey. You just need something so the bird's not fighting it if you can. And I put a little description here that if anybody wants to look at later, I think this will be on YouTube, they can look, but this is just how I dilute some of these. Ciprofloxacin tablets, like I say, can be diluted in water and given in a liquid. You just have to make sure that the tablet will dissolve. And ciprofloxacin has no taste, so that's very nice. And then, like I say, I use small syringes so they can squirt liquid in the mouth. You're not going to do well giving a pill to a bird. We don't need to do that. We need to make everything into a liquid. If we get on to leg fractures, then this is just something that I see, and I see quite a bit. And it's usually somebody that either sat on their bird or the bird flew into something or they got it caught in the cage. But when I do fractures, this is the lower end of the bird. You can see where we are there. Most of the leg fractures I find in birds are down low. Sometimes they'll be up in the femur, up high, but it's more uncommon, thank goodness, because it's much easier to splint them when it's down low. And on birds, I will use splints. I usually don't do IM pins or any big time surgery. But what I will do is actually use tape. And the tape I use is, we call it masking tape in this country, but it's just, we use it for packages and things like this. And it's just masking tape. And I like it because it is very rigid. It doesn't get soft and kind of like cotton tape or like your white medical tape. So it's a little more rigid, and it doesn't stick as tightly to the skin so it doesn't, when you're removing it, it doesn't, pull any skin off or anything like this. But you'll notice when I put a splint on a leg, and this little blue area right there is where a fracture quite often is, I am putting it like this. I'm not wrapping it around the leg like you would a normal splint on a dog or something, but I am taking it, and just like taking a stick and putting two pieces of tape like this, that's how I'm doing it. I'm trying to kind of cover a joint a little bit so that I don't get that rotation, because we don't want that to happen. But I'm going to go ahead and use a splint like this. Here's a stick so you can kind of see what I've done. If you think of the this upper area, and the knee would be up here, that if I want to do this, I would have made a knee up here. This is our tibiotarsus joint. And then here's our little ankle joint, and we go into the metatarsals in the toes. But you'll notice I've just put it on like this, and then I can trim it if I need to, but that gives you a lot of stability. And then instead of going over the joint, I just put a little piece down here, and that keeps it from going back and forth. You can see on a larger bird here, I've done the same thing, except I basically covered the joint with and use quite a few layers of the tape. Again, the tape I will put on a splint for some of the small birds like canaries or finches. They will leave those splints alone. When you have a bigger bird, you'll notice up here at the top, I have an Elizabethan collar or a collar on the bird so it doesn't reach down and pull on the splint, for two reasons. I don't want it to pull my splint off, but I also don't want it to wiggle the leg around, because it's like a small child. If a small child has a splint on, the last thing they need to be doing is running around and jumping and falling down. So we want to make sure that that splint stays on there properly. So let's see. So if we go with Elizabethan collars, and that's what we have around the neck of the bird, what Elizabethan collar is, it's a plastic collar, or sometimes people will make it out of a felt or a cloth even, but usually it's going to be plastic, and it's going to go around the neck of the bird, and it can either go straight out, or it can kind of go forward like a kind of a cone, or it can even go down that way too. So it can go this way, or straight out. But what we're going to do is use a thin plastic. I use a plastic called Lexan. However, you can use X-ray film or another light plastic that you can get. And again, we basically make a pattern and cut a circle. We want it to be wider than the bird can reach, just like if we put it on a dog, we want it to be beyond the nose. But I'm going to cut it that way. Or here's a piece of old X-ray film that I did. And then the area in the center is what's going around the neck. And the problem there is that can be very sharp. And so you want to make sure that it's padded. And because I don't want it to cut into the neck at all. So I'm using white medical tape that way, and just kind of folding it over the edge. And I'll put maybe 2 layers of that so it's padded there. And I want it loose enough that I want it tight enough that it will stay on the head and won't pull off. But I want it loose enough that the bird can swallow and go past the collar. I've, years ago, accidentally put a collar on a little too tight, and the bird couldn't eat. And luckily, the owner told me really quickly, and we adjusted the collar and everything was fine. But I'm going to put a collar like this, and you'll have a little cut in the collar. Like, say, if I go back this collar, you can see the little cut right there that I've put in the collar, and that makes it so we can, open it up and get it around the bird. And this is putting it on a bird. And then when it is on the bird, I'm going to use some tape, and I've put some tape here. Sometimes I'll use a clear tape because the bird can't see the clear tape to know where to chew it off. It's kind of funny on this collar, a little trick. Sometimes I'll put white tape just on the edges. And the reason for this is if the bird is going to try to chew at the collar, he seems to aim for the tape. And what I found is if I can keep them occupied for the first sometimes few hours or the first day, eventually they just give up and leave it on and don't worry about it. So I need to give them something to attract their attention. And sometimes I'll put little pieces of tape on there. But an Elizabethan collar is there temporarily. It's there so they don't hurt themselves. If they have a cut or something on their chest that I don't want them to mess with, or a surgical site that I don't want them to mess with, or a splint or some injury, then Elizabethan collar is good. It's not something you're leaving the bird in for ever, but quite often it's going to be on for maybe a week or two. And you want to make sure that it's large enough that the bird can't bite down and get to the edge or get past the collar to chew. However, you want it small enough that they can still eat and drink and move around okay. So those are things to think about on Elizabethan collars. And after a while, you get to the point where if you have to make them, it's very, very easy. It's just, you've just done so many of them. Another thing that quite often you'll get birds that are egg bound. And the last time we did this, some people had some questions about, egg binding or prolapsing from trying to push the eggs out. And with some people, like say we can, if we've got a bird that's having an egg, and quite often it will take them a couple of days to move that egg through the uterus or the salpinx down into the cloaca so that they can lay the egg. However, sometimes it'll get down in that area and either it is a soft shelled egg and it does not have the proper amount of calcium around the outside of the egg. And that can be a problem in the fact that when it's solid, the bird can push it out. When it's a soft shelled egg, a lot of times it is like a balloon with water in it where it just kind of wiggles and they can't seem to get it out. And these can get stuck inside the bird. Sometimes we can take a little bit of either what we call KY jelly or a water soluble lubricant and go in the vent and lubricate it up, hoping it will come out. Sometimes we'll use a little calcium injections. But what I find is usually the easiest way is what they call pro-banging, or I'm going to try to get it so the bird can go ahead and pass the egg. And on pro-banging, this is where you can feel an egg in the abdomen. You know that there's a problem. The bird has been straining to lay an egg. And when I feel the belly of the bird there, I can feel that I have an egg. I have something there in it. And a lot of times I will take a cotton swab and stick in there and see if I can feel what's going on. On a large bird, like macaws, sometimes I'll actually take my finger and go up in the vent because my finger's not larger than an egg is going to be. So I can go up there and feel it. And if I feel an egg that's up there and the bird has not been able to pass it, you can do what they call pro-banging. And what a pro-bang is that's where I'm going to aspirate or suck out the inside of the egg with a syringe. And you can go in, years ago, I used to just go through the skin of the bird, just go through the abdomen and just go right through there into the egg and suck it out. What I've found now is most of the eggs are low enough in the cloaca that I can actually, you'll notice here, I've stuck the needle in. Now I'm trying not to stick it through the skin. I'm trying to find a little area there where I can kind of get it up there and actually feel the egg. So I'm just going through the hole, and I'm actually taking an 18 gauge needle or a larger needle and going into the egg, and I'm trying to suck out the yolk and the white of the egg. So I'm just trying to suck out the inside, because I don't want to break the egg inside the bird, because it releases a lot of protein, and you can get what they call egg yolk embolus. It's a protein problem. It gets in the bloodstream. So we want to try to suck out the inside of the egg. And what you're going to do is stick that needle in there, and then I am sucking out all the inside of that egg, so that all I have inside the bird is an empty shell, just an empty egg shell. And then once I have that empty egg shell, a lot of times I can kind of squeeze, I can kind of do this to the side of the shell and get it to kind of collapse. And just like with a chicken egg, you know, you have the egg shell, and then you have the membrane on the inside of the, right inside the egg shell, and that will keep it from just falling apart. So it'll kind of stay together. And I want to take this big shell and crush it like this, which now is small enough to be able to go out of the bird. Sometimes I will actually take a cotton swab in and go in, and I can kind of tease it out, or you just leave it in the bird. I will lubricate a little bit on the inside and just let the bird pass that. And the bird should pass that egg usually within the day. But this does two things. It allows the egg to get out of the bird. And the other thing it does is sometimes when they're stuck in the bird, they put pressure on the kidneys if it's up high, and that can be a problem. So we don't want that egg in the bird. We just, if it can't pass it by themselves, get it out. Like say, if you've got a breeder with a very high dollar bird, they want to try to save that egg. Most of these are pet birds, and birds will go into breeding season, and they may lay eggs often. And you'll normally they'll lay an egg and wait a day and lay another egg, and they're finished. Sometimes they'll lay and lay and lay and lay. And sometimes if they have calcium issues and they don't have enough calcium there, they will actually get a soft shelled egg. And that's when we run into this problem. But like say, pro-banging it is a very quick way to get it out. And my thought is the bird can always lay another egg later, and we can have our babies then. When we get into prolapses, is sometimes we'll get a situation down here where you can see where the cloaca is actually kind of coming out, just like it would be on a dog or something like this. And that's from straining. And that can come from trying to lay eggs. It can come from sometimes even parasites and any or bacterial infections, anything causing the bird to strain. The most common cause that I see with this are the people that are loving on their birds all the time. And it's, oh, my bird is so much baby, and I just love you, and I'm stroking you, and you're, you know, my best friend. And the bird takes that as mating behavior. I always tell people, birds, the only time they really touch is when they're fighting or if they're breeding. Generally, you'll notice birds just sit in a tree and they're close to each other, but they're not really touching. They don't usually preen each other or take care of each other unless they're in love. So I don't want the owner to make the bird think that they're in love. So you don't want to do a lot of stroking on birds. You can sit there and say, oh, you're my best baby, and I'm done. Or talk to you and, oh, you're very sweet, and you're done. But you don't sit there and stroke and pet birds for 20 and 30 minutes at a time without having them think that you're sexually interested in them. And quite often at that point, sometimes they'll get very excited and I will see a prolapse. So in fact, I can easily say the last 3 prolapses I've had have been because of this reason. It's not eggs. It's because the owner was in love with the bird and the bird was in love with the owner. So I have this prolapse. Normally I can take a cotton swab and just push it back in. The problem is a lot of times the tissue is swollen and it will just keep coming back out again. So the most common thing that I will do on some of these birds is I'll poke it in. However, sometimes I will then take, and this is my bird here, but you'll notice I can put a couple of sutures in the bird, and you don't, in a mammal, you'd purse string them, you'll put the suture all the way around and then pull it, and it pulls it like this. On a bird, the vent is longer like this. And so what I want to do is put the sutures sideways. And my goal here is to make it so this is the hole right here. And it's too small for the cloaca or anything to come out. However, it's still large enough for the bird to go to the bathroom. Again, this is something that if the bird is laying eggs, you have to be careful of, because we don't want to have another egg up in there. However, if this is because the bird is in love, then I'm not worried about eggs. I just need the owner to quit doing what they're doing. But I will quite often put suture here. This can be absorbable suture. Absorbable suture does not absorb in birds as quickly as it does in mammals. So I'm fine whether it's absorbable or not absorbable. But I will put it just through here and just like 3 little sutures, 2, 3, 4, whatever it takes to make a smaller hole. And quite often, I will not even anesthetize the bird. If you have to use ketamine or something where you really don't want to have a bird under anesthesia, then like I said, you can quite often do this. It seems to be kind of swollen tissue, so they don't seem to be as bothered in my experience when you do that. But then again, I've been sutured and stapled up without any anesthesia myself, and it's not real comfortable, but you get the job done quickly. So you can do that. And quite often you need to put an Elizabethan collar around the neck to keep them from just reaching down and picking this out. The other thing you can do, if we need to, is you can actually surgically correct this. This is for a bird that seems to be prolapsing over and over and over again. And what we do there, and this needs to be under anesthesia, but you'll see down here where I've got the black outline, I will actually take a pair of scissors and trim around the skin on this bird. And then I will actually surgically suture the edges together. So I've trimmed this area, and then I'm just going to bring this together like this and make a smaller opening. I have a bigger opening, I trim it back, and I make a smaller opening here. And I'll put my sutures right there. And again, I've made an area that I can still put a cotton swab in and go around, so it's small enough that the uterus can't come out, or the cloaca is not going to prolapse. However, stool and urine will still come out. So that's a surgery that you can do if we keep getting that, over and over again. If a person wants to really get more involved in avian medicine, last time I said that Lefebvre.com has some very, very good videos that you can watch. But 2 organizations, the Association of Avian Veterinarians, and it's AAV.org, is an international group of veterinarians, a lot of continuing education, a good resource for learning more about birds. Also, the one at the bottom is Veterinary Information. And VIN is an organization that you join, but you can get on the computer and ask questions and look up topics that other people have discussed. And it's very, very good reference for doses and questions you have that way. But these are 2 two groups that are very, very good resources that you might want to check into. I was going to say if there's any questions, and I tried to do it last time, is hopefully here if there's any questions on chat, I'll try to quit sharing my screen and we can answer those, I hope. But if you have any questions after this, send them to the vetnetfoundation@gmail.com, and then I try to get back and answer every question the best I can. But what I was going to, let's see if I can bring up the chats. And I tell people I am not the best person on a computer, so that is a little bit of an issue. I'm going to stop sharing my screen right now so I can see the chats. And I want, what is the treatment for cloacal prolapse? You recommend the use of steroid just to disbalance. We usually do not use steroids much in birds. There's some work being done sometimes on prednisone, but it's usually for like a foot chewing syndrome that they have. So I usually don't do that. Now, one of the things that we will use on birds is there is what they call Deslaurellin implants. And these are actually little implants that you put under the skin. It's called supralorin or Deslaurellin. And Deslaurellin is a hormonal implant. Sometimes we've used one called Lupron, which is an injectable to try to back them off hormonally. But like I said, a lot of times what we do is we have the owners that just keep loving on their birds. And I'll talk to some of these older ladies that said, but I love my bird and I can't not, pet her because she just wants to be petted. And you're going, but you're causing the problem. So not steroids such as dexamethasone or anything like this. We find that's probably not a wise decision. And the hormonal imbalance is usually up there. So that's, something like this. As far as applying to poultry, yes. And I actually see a lot of poultry in my practice, everything from turkeys to chickens, but they're what we call chickens with names. These are people in the United States. A lot of times I have a lot of people that have like 3 or 4 little chickens in the backyard for the eggs. The problem with chickens is you have to make sure what your laws are as far as the antibiotics that you can use. Obviously, I don't see a lot of prolapses in the chickens because nobody is loving on their chickens and they're just laying the eggs. Sometimes you can get soft-shelled eggs in the chickens. However, those are quite often going to be either a problem with the shell gland, which is in the uterus, or the salpinx, or it's going to be a nutritional issue. Your antibiotics, yes, you can use them, but you need to check. In the United States, enrofloxacin and ciprofloxacin are illegal. Amikacin is illegal. I usually will use the trimethoprim sulfa, what I call the SMZ TMP. We will use tetracyclines. We will use sulfas. But generally, birds are birds. I don't have to worry as much about them using Elizabethan collar on a chicken because they don't pick it out as much. But possible reasons for a keel bone prominence, other nutritional deficiency. You're going to see, if I'm getting that razor keel, I say, I want to see, if I feel that keel bone here, I want to have that muscle about like this. If it starts looking like this, I've got a huge issue. And that can be a bird that's not eating. It can be nutritional deficiency, but usually if I'm losing weight, it's because I'm not getting a good diet. I've had people that have fed, when I've been overseas, rice hulls and things like this, and you don't get nutrition from rice hulls. You've got to have good nutrition, whether it be people food or seed or grain or something like this. So usually it's either going to be, it's a bird that's not eating. In most cases, sometimes it can be it can be a disease where they've got bacterial infections, so they're not eating that way. But when you see that, we need to get that bird eating again. a dose on ceftriaxone IM inverse. I am not familiar. These are norfloxacin. I'm not familiar with using in the United States or either one. I can see if I can find a dose and I can put that on later on, and I'll try to send that to the VetNet Foundation if I can find that. But those are two things we really don't use much in the US. Crop burn and sauerkraut. Okay. Crop burn is something I can talk about next time. In fact, if anybody has anything they'd really like me to address, do this, because on my third talk, I'm happy to do that. On a sauerkraut is where you've got fluid in here and it's just not going down. And the reason it's not going down is because something's stopping it from going down. On a crop burn, this is usually where people have hand-fed babies and you're putting a crop tube in there, but quite often using a microwave oven, and they've got it too hot, and you get this baby formula in the neck and it burns a hole in there. If you've got a crop burn, you're going to have a hole and there's food leaking out of that crop. And what you have to do there is, once you notice that, you do not want to fix that immediately. You need to wait at least a week on a crop burn and let that, what they call demarcate. We need to let that calm down a little bit, and the good tissue will look like good tissue and the bad tissue will rot away. And then at that point, once we've waited a week, and you just tell people you're going to have to just kind of put a little bandage over it or something and make sure the baby food is getting enough that we can leak out and get in the bird. Then what we do on a situation like that is we have to anesthetize the bird and separate the skin from the crop, and then suture the crop and then suture the skin. You cannot suture them together. You have to separate the two layers to have a successful closure. And this is not a difficult surgery, but you cannot just find the hole and put stitches in there and close it like this. You're not going to have a successful surgery. You have to tease the skin away and then find the crop, do a continuous suture to close the crop, then over the top, close the skin, and the babies do quite well on something like this. Control the edema of a prolapse cloacal before reposition. If on the edema, what I usually find is if you can get it back inside the bird, it's not being kind of strangulated to get that edema. Now in mammals and things, a lot of times you can't get the cloaca back, or you can't get the rectum back up in there. I'm sorry, the uterus or whatever back in there, or whatever you're doing, because it's got so much edema that you can't push it back in. On birds, I've never had a situation where I couldn't get it back in. And then once you get it back in, the swelling will decrease because you're not closing off the blood supply anymore. So I just try to push it in. I am then going to take a swab and kind of go in there and try to push it in as far as I can so it'll not be bunched up. And a lot of times I will use my finger. I'll just take my finger and go in there and, just kind of make sure that everything's in proper position, and then I'll close it. So I don't worry about the edema. I don't, in mammals, we use sugar or something like this to pull out the fluid, but I haven't found that to be a big need. If somebody has other experiences, like say, put it on the VetNet Foundation, let me answer it that way. In anorexic conditions and having diarrhea, apart from antibiotics and fluid therapy, advise you get fruit juice mixed with egg white, albumin. What you're trying to do is get nutrition into these birds. In the United States, what's nice is we have a lot of what they call hand feeding formula. And so it's very easy to just mix that up and use. Back before we used to have that, when it was 30 and 40 years ago, quite often I would use baby food. And we've got Gerber's baby food, but we'd use baby formula, that you would mix up and give to a baby, and you can do the same thing. You just need something to go through a syringe. Fruit juice, yes, you don't want to give them straight water or liquid. You really want some sort of texture, and the reason in there is you don't want to choke anybody. And usually when I do this, we'll actually have a syringe with a little tube, so it'll go past the opening of the trachea there, which is right on top, the back of the tongue. So I like to get it past it. Prefer not to use raw egg. That is protein. But like I say, what you want to do is just get something in a mush that you can get into the bird, and we will use tube feeding, and I'll try to address that next time also. So infant baby formula is what I use. If you've got something used for baby birds, that's what I give the adults, although sometimes I'll add a little bit of honey to it. It seems to make it a little tastier for them. But you need to get nutrition in there. Human baby infant formula is good. Now, not the milk, but the grains that they use, like we use Gerber's baby cereal in this country, and you can use that, and that's the thing that I generally do. On the calcium for egg binding cases, the dose and the route you follow. If you're using calcium in these, it's IM calcium gluconate. I will put the dose. I have heard that anywhere from 5 milligram to 50 milligrams per kilogram IM. It's a little controversial on, does it really even work? That's why quite often I will pro-bang these eggs just to get them out of there, because I'm not convinced that calcium is going to work quickly enough to really take care of my issue. If I feel I have a calcium problem, I need to correct it more on a chronic basis and not something right that minute. I will put that dose. I'll get that, but like I say, I've seen it 5 milligrams per kilogram IM, like you would give a dog or something like this, and I've heard it 50. So it gets very controversial on whether it even works in mine. But anyway, before suturing prolapses, any medication in the vent, I don't put any medication in the vent. I will quite often take and kind of lubricate it up a little bit to make sure we push it up there. I don't use any antibiotics in the cloaca. If I feel like I need antibiotics, I'm going to give those oral, usually, or injectably. But usually I'll put them on an oral antibiotic if I feel like they need something like that.